When you're on original Medicare and a Medicare supplement, you don't have any of that, where the Medicare Advantage plans, they have networks, co-pays, dental, vision, all that. Feels very similar to group insurance, but what the commercials don't tell you, and whether they're low income, middle income, or high income, nobody wants to inherit a tax consequence. Nothing's worse than thinking you've got coverage and then you go to trigger that benefit and then now you've got to front the money. Then you have to get receipts and fill out paperwork and then submit it to the insurance company. I mean, that stuff takes...
Welcome back to another episode of the Mind Your Own Business podcast. Today's guest is Shantel Haines from Next Phase Consulting.
Yes.
Welcome.
Hello.
How are you doing today?
Good.
I'm great. And we know each other because
I'm upstairs.
Yes.
You let me hang out upstairs.
Yes. You're in the office, so we see you all the time.
Yes.
How's everything going?
It's going good. So we've been here since August and...
When you say we, what's the name of your business?
Oh, okay. So Next Phase Consulting.
This is Mind Your Own Business.
Mind Your Own Business.
So what's your own business?
So my business is, all the fun things. We do full holistic retirement planning. So I'm an advisor that focuses just in the distribution phase of life. My clients are not 30 years old accumulating wealth. I mean, obviously we still have portfolios growing, but it's a completely different science. So it's all the fun things from Medicare to required minimum distribution planning to tax strategies to QCDs to all the fun things.
Okay. Some of those things I know. Some of those things I don't. QCD.
Yes. Love that.
What is that one?
So I actually, we just had a client that I just wrapped up with, and she is next year going to be forced with required minimum distributions.
Okay. And can you explain to us real quickly what that means?
What that is, yeah. So for example, we have, 401ks, IRAs, 403bs, these retirement accounts, but we share them with Uncle Sam. So Uncle Sam at a certain age says, okay, knock, 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 I want my portion. So you have to take a withdrawal. So forced required minimum distributions out of your retirement accounts that you share. And what happens is usually people are forced to take those and they don't know what to do with the money, or so we just make sure that dollar that's coming, it goes a most efficient way. And one of the most popular ones are QCDs. So for example, let's say I give a donation to the church or a charity. You are able to use your required minimum distributions to give as a donation, but it takes you, the middleman, out of it, so you don't have to pay tax on it.
Gotcha.
So beautiful, beautiful things.
That's beautiful because I don't want to pay taxes.
No.
Or pay less taxes.
Yeah. So I am super passionate about just educating people. There's so many different things. People aren't retiring. Like, you're not going to retire how your parents retired. Like, it's way more complicated than that. Healthcare alone. So I educate people about their rights and options. And I kind of organically came into this business. My husband, Zach, was injured in Iraq, and he was Medicare eligible in his early 20s.
So you had to navigate that whole world of Medicare.
Yeah, he got a red, white, and blue card in the mail, and I was like, what is this? Why does it have your name on it? Isn't this for old people? What's going on? And I just knew two things. It was like, okay, if this is another line of insurance, I don't love the care he's getting at the VA. Like, how does this work? Mm-hmm. So that's when I just learned how does original Medicare work, and then also paired with his veteran benefits. So like he's got TRICARE for life, so that works differently with with Medicare versus Champ VA and all that good stuff. So then when I just started learning about his, I just kind of organically started helping people and telling people.
Yeah.
So that's where I started. I started helping people with just Medicare. I got addicted to, I'd be in Kroger and I'd tell my husband, I'm like, I could probably save her money on her prescriptions. Like, you just never know. So when I meet people, it's like, just give you education. It's up to you. It's your healthcare. Even when it comes down to Social Security. So again, kind of, started with Medicare, helping people. We went through a situation with Zach with Social Security benefits, and it was frustrating. And then because when you go to the Social Security office, do you know that they legally cannot advise you?
I would guess that just because I'm a lawyer and I know that you go to the courthouse.
People would not think that.
Yeah.
But they legally can't advise you. And it's just frustrating. Like, Bob would say this, Nancy doesn't work there anymore. Joe doesn't, you know what I mean? Like, it's just frustrating. So I then became a national Social Security advisor because I want to understand, like, what are the rules? What are the laws? So then started helping people with Social Security, and now we're just full holistic planning.
That's amazing.
All the things.
Organically from your husband being injured in Iraq.
Yeah.
To Medicare, Social Security, now, investments and retirement accounts, taxes.
Yep. Long-term care. Oh my gosh. Long-term care. We're in a long-term care crisis.
Yeah.
Nobody wants to think about long-term care. So educating people about what's available out there, because all these new facilities are popping up everywhere. And guess who's paying for them? Us.
Yeah.
Through taxes, through Medicaid, People don't think of that because, maybe you're, not on Medicaid and that, that isn't part of your equation, but you're funding it. Yeah, just understanding how it works, understanding, if I do have original Medicare, where does Medicare stop? Because Medicare doesn't pay for long-term care. It's really crazy. Again, I apparently all these life situations that I'm having gives me a calling to help people, because I've helped people with long-term care for years and now have a whole new perspective with, taking care of our son. It's just crazy. So you got to understand, where does Medicare stop and where will long-term care come in?
Gotcha.
And fighting this whole battle. So open enrollment just ended. So each year through like October, beginning December, if you're on Medicare, open enrollment's when you can review your prescription drug plans or your Medicare Advantage plans. And these Medicare Advantage plans are just shoved down everyone's throats, and people don't understand how they work.
What do you mean by that?
So there's a couple different ways you can age into Medicare. Most people age in turning 65.
Okay.
Or if you're on Social Security disability for more than 24 months, you're Medicare eligible. So when you have options with original Medicare, Medicare is amazing. People don't realize how awesome Medicare is because they think, oh, it's government insurance. And what part of the government's great? So
you said it, not me.
Right? I know. I hear it all the time. But if I'm offered original Medicare and if I'm under 65, my only option is a Medicare Advantage plan. But if I'm over 65, I can keep original Medicare and go on a Medicare supplement. But Medicare is completely different than group insurance, and that's what we're used to. Mm-hmm. We're used to
the health insurance you get through your employer.
Through your employer, or you can even get through. So in Georgia, it's called Marketplace, Georgia Access. So basically, you're used to networks and co-payments and high deductibles, and premiums are really high. I mean, the premiums are insane. It's different. When you have original Medicare, Medicare covers 80%. So you go to the doctor, I have a $100 bill, Medicare covers 80%, I'm responsible for 20%, they pay $80, I pay $20, this is awesome. Right. Disadvantages is there's no stop loss to that 20%. So you don't want to be responsible for 20%, sky's the limit.
Right.
And I mean, medical bills are insane. So
tell me about it.
Yeah, it's ridiculous. So whether you can stroke a check for it or not, you just containing your medical cost, especially when you have assets, is so important. So you can choose a Medicare supplement that will take care of everything that Medicare won't cover. So you can read about it in the Medicare and You book, but they don't advertise a whole lot. Then you have original Medicare, Medicare supplement, and then you have a drug plan. So those three cards all marry together. The other option is a Medicare Advantage plan. And a Medicare Advantage plan is what all these commercials and everything are about. And they'll give you dental, vision, all the things, which feels very similar to group insurance. In group insurance, we're used to it all together. Well, when I have original Medicare and a Medicare supplement, you don't have dental or vision. The funny thing is Medicare does not care if you eat, see, or chew. Did you know that?
I had no idea.
But
you think those things would be important?
You do, but it technically does cover like the organ of the eye. That would be medical. It's just our eyeglasses and dental cleanings and all that stuff that Medicare doesn't cover. So that's why people are enticed to go on a Medicare Advantage plan, is because it kind of covers everything and they're free.
Free?
Yes, these Medicare Advantage plans are free. So when you go on Medicare, A is free, but B has a premium, and it can be, I really went down the Medicare wormhole here.
That's fine. People need to know.
Oh, but when you're on original Medicare and a Medicare supplement, you don't have any of that, where the Medicare Advantage plans, they have networks, copays, dental, vision, all that. Feels very similar to group insurance. But what the commercials don't tell you is when you go on a Medicare Advantage plan, you actually forfeit original Medicare rights and options, which is very frustrating and confusing, because I get clients all the time. They're like, well, what do you mean? I'm paying for it. They're automatically deducting it from my Social Security check. It's in my pocketbook. Here's my card,
right.
And it's like, yeah, that's that 80% coverage you no longer have. And the scary part about it is you don't know the effects of it until you have an incident where you maybe need skilled nursing and, there's a bed available, but they don't take your insurance. So you drop that Medicare Advantage plan, and then now you're on original Medicare with this huge, huge gap.
Wow.
So anyways, it's a whole lot. And I have clients on both sides of the fence. So if we have Medicare, Medicaid, a Medicare Advantage plan is the way to go, but we're really picking a plan to maximize your benefits, not necessarily for your coverage. So yeah, I'm just passionate about educating people. It's not, if, anybody should be alarmed if they talk to someone and they're just talking about, they give you this, they give you that. They'll give you a gym membership, You do not want to base your healthcare needs on 2 cleanings and a gym membership that you're probably not going to use.
Fair enough.
So just educating. I just like to speak to people in layman's terms. I try to be the person that I needed years ago when it was like, okay, I can read about this and I can read about that, but how does this apply to me and our situation? That's when I sit down with people, and that's kind of where the name came from. It's we sit down, it's a consultation, and we're helping you transition through this next phase of life.
Awesome. So it came about organically because you had some personal needs and you needed to figure this stuff out.
Yeah.
Sounds like you totally figured it out. And not only figured it out, but you were able to turn this into a profitable business.
Yeah, but never any intentions. I wanted to own my own boutique. I love clothes.
Okay. So from clothing boutique to Medicare plans.
To be in financial services. I never thought, but no, I love people. So, and when there's a problem, I love, figuring out and do you know anything about Enneagrams?
Enneagrams?
Yeah.
No, I don't even know what that is.
Take an Enneagram test. So an Enneagram is basically, it's kind of like a personality test.
Okay.
So I'm an Enneagram 8. So I feel the need to defend in people. So I think that's where this all comes from, is I've learned this information. It's very powerful. It's very confusing for people. And I'm Enneagram 8. So I feel the need to
share the knowledge.
Yeah.
Cool.
And stick up for it. But yeah, you should take an Enneagram test.
I will.
And then also the girls in the office should take one as well, because then it would help you communicate effectively with them.
Okay. Well, I don't want to talk to them, so just kidding.
But anyways, but yeah, so that's just where it starts. And and I don't do portfolio minimums. You don't have to eat, you see the commercials, especially on Sunday. There's some big firms around. It's if you have $500,000 in your portfolio, we'll do a free consultation. I have clients that are Medicare, Medicaid, all the way up to multimillionaires that need everywhere in between. So I don't do portfolio minimums. I don't, charge for consultations. But I'm not everybody's cup of tea. So people may sit down with me and I may say, hey, hopefully you learned something from our conversation. I may never see you again. But yeah, it's just anywhere and everywhere in between. Estate planning. Estate planning's huge. Just understanding what is probatable, what is not probatable. So I talk about a lot of things, but I'm not a CPA and I'm not a lawyer. So I stay right in between. But education, knowledge is power. So,
cool. And I like what you said. You're not everyone's cup of tea, which I think in business, especially in small business, you can't be everything to everyone.
No, and I don't want to be.
Yeah, and I think that is where you can kind of shoot yourself in the foot trying to get every client when it's let's just work for the people that want to work with, I guess, you and what you service and your personality.
Yeah.
That's sort of my approach anyway.
Yeah.
You find it has helped you?
Oh, absolutely. I mean, that's where, I tell my clients the best thank you is a referral. Right. And it's just, but we also too, so I also originally started, I was going to people's homes. I was just helping people. And when you are in the field and you see, how people are truly struggling, when you see someone who doesn't have the physical capability to earn income anymore and they're living on $1,100 a month, like what struggles do they actually have? What environment does this budget provide and all that stuff? Like you meet some of the best, amazing people. Now I've also had some stories. So the funny thing is when I first started this, my husband would drive me. So Zach would drive me. Yeah. Yeah. Because you go into some sketch areas and I'm like, I don't care. Like, I don't care. Yeah. Like I'll meet in the trailer park, the apartment complex, the high rise. We'll sit on your porch. We'll sit whatever. Yeah. I help people with my iPad on a hood of a car before. Like, but when you get like those are the people that need the help the most, and you meet all walks of life. But when that's where it starts, and I'm just how can I service people? But when I first started, it would be like, okay, did you make any money today? And I'm like, no, but I met so-and-so and so-and-so and so-and-so. But yeah, it's just Medicare's the wild, wild west. There's a lot of people out there that will sling insurance. There's a lot of people. There's a lot of people that come in the insurance industry and they're here a little bit and they leave. Right. It's hard. It's really hard. But when you're there for the right purpose and, you've got great people around you, that's where we help people apply for extra benefits, save on your prescription drugs, all things. Those things don't receive compensation, but that's what we do when you're part of the family. We take care of you. Yeah, that's awesome. And it's just slowly built and yeah, it's been great, but we are blessed. Our family is blessed. So how can we help and serve? That's my mentality, because I can meet two same families, exact same portfolios in two completely different directions, and I'm not a mahogany table and giving you a leather portfolio and like I'm usually wearing jeans and a cardigan to work. Like cool. That's what, yeah.
If that's what your clients want, then that's who you are.
That's who I am.
So
yeah.
Cool. So you mentioned a little bit about the retirement accounts and things like that, but you don't really service people who are, in their 30s or just getting started. Tell us about when people need to consider the next phase. Like what sort of phase of life? 30s, 40s, 50s? Yeah, so when do they need to start thinking about these things?
So if I had to put an age on it, I would say roughly like mid-50s. Okay. So, we are contributing to, like Social Security, for example, Social Security timing. You are paying into something that you are going to have to depend on in the future, but ideally, that needs to be one slice of the pie. That's not your whole. Like Social Security was intended to be, Social Security started out upside down. The lady who actually that received the first Social Security check, I wish I should have looked at this number before we jumped on here. But she basically paid pennies into it and received thousands back. So the intention of how Social Security started is not what it is now. And, so many people are dependent on it. And it's like there are other things that you can do. And it's not just, I need $1 million to retire and I'm going to bank on the 4% rule and all that. There's a lot of different unique ways to be able to create yourself another pension. Pensions are the day of the past. People used to have jobs where they were contribute to Social Security and contribute to a 401 and contribute to a pension. So when they got out, they had multiple streams of income, especially if it was a husband and a wife. And it's not like that anymore. So you need to plan for that. But it's, like I said, it's kind of like a mountain. It's like a retirement mountain. So if you're like roughly 55, you might be right here on the mountain. We're not done climbing. But my job is to make sure kind of the ride going down is smooth. And you don't fall off the side. You don't fall off the side of the mountain. Yeah. And I have, like I said, I've got clients who choose this or choose that. Some want to spend it all. Some want to leave it. Some want to But tax efficiency, that's where, estate planning comes in. There's legacy, long-term care. So containing your medical cost, outliving your portfolio, and long-term care, those are like the biggest pitfalls that people can face. So you want to protect yourself from that exposure.
Gotcha.
Yeah.
It doesn't sound like there's a ton of people in your industry, or am I wrong?
So I think people are, but I think you're going to find them that are do this or they do that. So there's just people that help with maybe insurance, or there's just people who, manage your accounts, where we're a hybrid of both. So, and at Next Phase, we follow a fiduciary model. So what that means is when you do better, we do better. You want to make sure you don't just have, a stockbroker that's moving money and they make money whether your portfolio is performing or not. But I'm not a one-man show. So whether you have whatever line of business we're helping you in, like I have a whole team. So yeah, so it depends on what people need, but it's at least worth a conversation. Gotcha. So, but yeah, kind of to answer your question, 55-ish is kind of like that retirement red zone. Mm-hmm. We're entering. Maybe our statements are that number looks a little bit different. We may be receiving Social Security. If you don't have an SSA.gov account, get one, because they're not sending statements anymore, paper statements in the mail anymore, which is really good. We spend a lot of money sending Social Security statements that people don't really look at all the time.
Nobody reads.
Yeah, and that Medicare and U-Book. Oh my gosh, we spend so much money on that. Anyways, nobody asked me.
But you mentioned you're a fiduciary, and that means that your duty is to the client. Is that correct?
Correct. So at Next Phase, we follow a fiduciary model, and yes, it's what's in the interest of the client. But what I like to do is your client is, you're in the driver's seat, because it's a weird shift. You're not used to, not being in control. Or honestly, I had one gentleman. He was like, you know what? I just really hadn't thought about it. Like, what you do well is putting your head down, you're working, those are the years that, you're either raising families and then kind of we wake up and we're like, oh gosh, maybe I'm about to pay my mortgage off. And what does this really look like? And a lot of people can retire as long as they have good cash flow. You don't necessarily have to have this big lump sum. Okay. So, but yeah, we just sit, we plan it out. Sometimes, I give people information and they're like, okay, thank you, but no thank you. Like, okay, there's no pressure. I don't like to work under pressure.
Yeah. So you just educate the client or potential client.
Yep.
Give them some options.
Yep.
Tell them what to think about. And then, if they decide you're not their cup of tea or they want to go somewhere else or figure something else out, that's totally fine.
Absolutely. Or they may say, hey, I already have an advisor that I have a great relationship with, and I just want you to help with this portion.
Okay. Cool.
I'm not trying to interrupt relationships, but I also do kind of plant some seeds to ask some questions to challenge things, because it's not just the distribution phase is just a completely different mindset.
Yeah.
And, nothing's worse than thinking, okay, I'm going to retire. I'm focusing on, my income and this certain dollar. And I think I'm going to go on Medicare. Maybe I just talked to somebody, I have a separate advisor versus a separate insurance person. And my insurance person isn't asking the financial questions. And then I go on Medicare and I think my Part B premium is going to be the base. And then I actually have an IRMA increase. Then it's like, so IRMA, IRMA. So it stands for Income Related Medicare Adjustment. Okay. So your Part B premium is based on your income 2 years prior to being Medicare eligible. So all my clients that are going Medicare in 2026, it goes off from your adjusted gross income in 24. So maybe we didn't necessarily have high income, but maybe we said, let's go ahead and cash out my 401. And that affects your Medicare Part B. So that's why it's nice to have one person kind of does everything, looks at everything together, because they're all connected.
Yes. I think that's really important, because you also touched on the tax implications of things.
Yeah.
And I know you're not a CPA, but can you tell us a little bit about how you can optimize this for the most beneficial tax consequences?
Yeah. So when we have these pre-tax accounts, so remember I was talking about like our, 403Bs, 401Ks, traditional IRAs, whatever they are, when we have these pre-tax accounts, when we take it, that's when, am I going to pay, tax on it now or in the future? Mm-hmm. So this is maybe a personal opinion, but if you look at the history of taxes, they are just going to go up. So kind of kicking that can down the road is not always beneficial. So each year when we do annual reviews, especially once maybe we've retired, because sometimes the biggest misconception is, I'm going to retire, my income's going to go down, and then I can do a bunch of Roth conversions. And that's not always necessarily the case. And people think, I'm going to go down in my tax bracket. And that's not always necessarily the case. So also when we meet with in reviews, it's like, okay, how much wiggle room do I have this year? So if I do have a lot of qualified assets, and maybe I've got a little bit of room where I can convert $20,000, to a Roth, and it doesn't bump me the next tax bracket, that's where you get that advisement from me in that next phase. And I have some clients where I sit down, they're like, okay, I've got this wiggle room, but I'm not going to do it this year. Completely up to you. Mm-hmm. It's complete. I'm just here to give you the information.
There you go.
And then we also set up those accounts. So through the years, when you want to do those things, then, we have the buckets established, and, it's not just clean, and contributing is a completely different science than just like off distributing. So,
well, that sounds like there's a lot there.
There is.
And
it is.
I mean, I wouldn't feel comfortable doing any of this on my own. So you have a team. Yeah. Tell us about your team and how you built that team.
Oh gosh. Okay. So yeah, I've got a few girls in the office, but we have a deep bench behind us. So, for example, I just met a lady the other day, and she was like, hey, Shantel, I have this long-term care policy. Can you review it? Okay. I am a smart cookie, but there are a lot of long-term care policies out there, and I don't know all the things of all the things. So we're able to submit it to our long-term care team, and they can review it, and they can tell you the good, bad, and the ugly. So when we have things, annuities are great things in retirement planning, but there's so many different types of annuities. And if anybody has an annuity that's over 3 years old, they should definitely get it reviewed. Rates are very favorable right now in those. But you also want to make sure it's the best fit. Now, some people don't want annuities part of their plan, but we just talk about what's available out there. So I have a great team that's here, but then we also have a deep bench behind us, depends on, the category. Oh, yeah. So about the long-term care policy, the lady that we had reviewed. So sometimes we review it and I might say, hey, this is great. Hold on to it. You need to understand how it works. Or sometimes it's, there's new things available. You can transfer it, or this is great, but you really want to monitor it in the next 10 years, you may need to make a decision. So yeah, just when we review things, it doesn't necessarily mean that I'm trying to write business. That's not how I do things.
Gotcha.
Yeah, no, that's gross. There's a lot of advisors out there that will do that.
Right. And I think that's sort of...
Yeah. That's not how I got into the business, and that's not how I would want to be treated.
Right.
And these clients are family. This year my son was injured and is now a quadriplegic, and guess who showed up for me? It's my clients. They were calling and checking on me, and my clients are. So it's like, it's a family. Like I said, when I first started, I would sit at people's kitchen table. That's why when you come in my office, we sit at a round table. I don't sit behind you with that barrier. I'm sitting with you because I'm on your team. I'm your advocate. I'm here for you.
Nice.
So.
And you mentioned a little bit about estate planning. Can you tell me how that ties into this whole picture as well?
Yeah. So trust are everybody, you can get a trust here.
It's the sexy thing, right?
Is that what it's like, and not everybody necessarily needs a trust, but wills are probatable. So, this is where I can see ugly things is
let's just tell people. So when you say probatable, that means if you have a will and you pass away, your will goes through probate, and a judge determines, based on your will, what happens to your assets.
Correct. Right? And that takes time and takes away from the asset. So a lot of times people are like, okay, well, my IRA is, my kids are the beneficiary on it. Oh, okay. Well, if this IRA that we share with Uncle Sam, you want them to inherit a tax consequence? And whether they're low income, middle income, or high income, Nobody wants to inherit a tax consequence.
Yeah.
So that's where estate planning comes in, and just understanding even just little things that we talk about is maybe on my checking account, I need to have a TOD, nothing. So it's transfer on death, and not just adding my daughter or my son or whoever to my bank account, because these are real things that happen. Is, let's say me and my husband are on a checking account. He's receiving Social Security benefits. He passes away. I need to go pay bills. Well, they've frozen my checking account. Heaven forbid if something were to happen to you and your spouse and your kids need to go pay your mortgage. That's where a TOD is beneficial more than just having your child on your account. So those are things that we talk about, all the fun stuff.
Yeah. It sounds totally fun.
Yeah. But we make it easy, and we take it off in chunks, especially when you sit down and it's an overwhelming conversation.
Yeah. This has been overwhelming for me.
Yeah. We take really good notes. My girls in the office are going to reach out to you. So even let's say we sit down and you're 60 years old and, you're not Medicare eligible until you're 65. Well, we're going to still be here. So see you in 4.5 years. We'll call you and we'll review your rights and options then. So we make it manageable and just take all the stress away for it. But I sit down and I talk with people in layman's terms. I'm not talking over your head. And we will repeat it 40 times if you have to. And because when you sit down and you talk to someone and say, oh, Shantel, I need all these things. And then we start, and kind of chip away, and it goes in phases.
Yeah. And I think that's really important that you talk to people in layman's terms, because I've learned that in my, business as an attorney. When I would start out, I would, use legal terms, and I'd look at people and they're looking at me like, what are you talking about? So I've tried to, figure out how to discuss things, important legal things, in a way that makes sense to everybody.
It's a huge game changer.
Because if not, they're like, what are you talking about, dude? I don't care.
Yeah. No. And how does it affect me?
Yeah.
That's the biggest thing. Like, I can sit and sound smart and talk about all this stuff, but I'm not going to talk about the things that don't apply to you and your situation. And it's fun. Every family is like a little puzzle.
Yeah, everybody's situation is unique. So I guess it is totally different.
It's so unique.
Cool.
It's so unique, but we love it. It's like I said, it's a relationship. Like when I first started, I was hitting the pavement, and now I'm fortunate enough that I am in an office, so I'm able to see a lot more clients. But yeah, I mean, if you go to our website, there's tons of different things. So my website is npcga.com. And if you go in there and you go to like the estate planning tab, there's a little quiz you can take. And based on how you answer that, it'll let you know, do I need a will or do I need a trust?
Oh, cool.
Or, for example, I think this is what I was starting to talk about, and then I lost my direction, where people are like, oh, I have 2 kids. We just split it down the middle 50-50. What we see is the not so fun things. So what happens to heaven forbid, mom or dad need care. Not in every situation, but usually there's more pressure put on the female child to, healthcare, home care, whatever that stuff is. Because, so the reality is, if something happens to my parents, like my brother's going to make sure everything's working around him, doing the actual physical home care, maybe something that would, land on my shoulders a little more. And I've had, families have personal feelings and things go sour. And that's where, if you have a true estate plan, you're doing them a favor, really. They're directions from the grave. And whether they don't know because you've never had that conversation, because these aren't fun conversations, but you kind of take it out of there. So, let's say because right now, where we're at, heaven forbid, if something were to happen to my parents, my brother has to take that weight because of what my demands, me and my husband's demands are at home, which he would gladly do, but that wears. And when people have situations that last years, then he may think, oh, well, I deserve more.
Yeah.
I did more, and those are just natural feelings. We're humans, nobody's thinking ill intent. Or what if people, live across country and, maybe you live near your parents. So more of those checking on them, those things are going to So it's just all those things. So when we talk the more personal side of things. It's a true consultation. It's not just a plan. And life happens. We put a plan in place and we pivot throughout the years. So
The important thing is you're thinking about it. You're planning for it.
Yes.
Yeah.
I just want people to have the conversations. That's all I am right now. Just like long-term care. The biggest conception of long-term care, people think, it's a facility. I don't want to go there. Take me out back. Well, you can't do that. But majority of my clients, they want to stay home. We want quality of life at home. And we're not like bedridden and not living anymore. We just need assistance with 2 of the activities of daily living. We still have great quality of life. I just need some help.
Right.
So a lot of times that's where you can trigger those benefits and that dollar goes to you, especially when it comes to long-term care policies. You don't want these reimbursement policies. Nothing's worse than thinking you've got coverage and then you go to trigger that benefit and then now you've got to front the money. Then you have to get receipts and fill out paperwork and then submit it to the insurance company. I mean, that stuff takes time and effort and money, and then you get reimbursed. You want to be in an indemnity plan where, you're going to your doctor says that you need help with 2 of the activities of daily living. The trigger, the benefit, it gets paid to you, and then you get to pay. And the biggest thing is I hear, my son, my daughter, my child, my children, they're my long-term care plan. Okay, well, that's great, and they can be, but wouldn't it be amazing if you can compensate them, give them some extra money? Or what if they need to quit a job and you need to replace their salary? So much that goes into that. But the thing is people need to understand there are solutions out there. And when you go to the website and you go to the insurance tab, you can go down to long-term care and there's a link there. And it's literally ask you about you and your health and, just all types of things. And it kind of builds out your long-term care trajectory. So when you fill that out, it produces a report that sends it to me. And then we get together, we look at that, and then we talk about solutions.
Cool. I like it.
Yeah. We make it easy.
I want to switch gears a little bit, if you don't mind. You talked about how you got started in the business. Mm-hmm. I want to hear a little bit about how you built the business. So where do you find your clients at? I know that you do a lot of education.
Yeah.
I think you do some seminars.
Education. Yeah, I do a lot of seminars. I teach a class out at Ollie at UGA, volunteer my time and teach over there. And then a lot of referrals. I mean, when you're in a small town, one person leads to the next person, leads to the next person. So I get all caught up in building a business. And honestly, I just keep my head down and work and help people, and it just organically comes.
That's the best. That's the best way to do it.
Yes, because for one, how's their time? And for 2, it will come. So for example, right now you can't find me on social media. You can go to my website, but it's coming. So I don't like to half-ass anything. So I won't do it unless I can give it 150%. But and we're working on building our YouTube channel. Because there's a lot of people that I'm helping right now in North Georgia, but I would, how can I help people other places too? And it's not even yes, I would love you to be our client. So we get compensated from different companies. That's how we keep our lights on and our bellies full. But there's a lot of free work that we do that doesn't receive compensation, but that's how I choose to work. I wouldn't have it any other way.
Well, that's very admirable, I'll say. So the clients don't actually pay you money. You get paid from the companies that you send them to.
Mm-hmm. And sometimes I do a lot of work for free.
Yeah.
That's my choice. Yeah. That's my choice. Yeah. It just does. And that's the right thing to do.
And I think it comes back to you.
Oh, for sure.
Yeah.
For sure. Yes.
So you mentioned you don't have socials now, but you're working on those.
Yeah, it's coming. YouTube channel's coming with a bunch of
I think the YouTube is going to be great because you're going to be able to put out videos like this.
Yes.
And educate people.
Yes.
So they can go to do you know what the channel is going to be called yet?
No, I have no idea.
Okay.
Probably next phase.
Phase. Okay.
Yeah.
We'll redo this.
We'll redo this when I've got, but yeah, people need to understand, and you need to advocate for yourself. And because I have some people, like, for example, like, let's say they go into Medicare and they're like, okay, Shantel, I'm listening to you. I'm going to get, Medicare and this and that. And that's the highest level of coverage. This is what I've got. And then you go on it and you have it. And then you turn around and, something happens and then you get a $4,000 bill in the mail.
Yeah.
Well, instead of freaking out, we need to understand, what do I have? Well, how does it work? Because, people mess up in billing departments all the time. And, just understanding what you do have. And when you get to a point where you can't really advocate for yourself, we're here to remind you, help you. I have a lot of clients where it's like, okay, I'm communicating this to the daughter because now she's taking over, because people get taken advantage of in this life after work phase is what I like to call it, not necessarily retirement. But people get taken advantage of. You need to be careful. Don't answer your phone. People get bombarded. I really feel like they should make it illegal to
solicit.
Yes.
Yeah.
It's awful. Now, Medicare has tons of rules. You have to sign a form, that says I'm going to let Shantel look at my Medicare or just even talk to me about Medicare. We're not even doing anything. So there are, rules put in place, but there's just a lot of gross things that go on. Yeah. And people get taken advantage of. Well, and it's sad.
It's also scarier now because with the artificial intelligence that you can create a voice and have it say anything.
Yeah,
and
it's
sounds
scary.
super official and call somebody up who may be elderly and not used to technology or know what's going on in the world. And
no, it is scary.
Try to sign them up for whatever.
Yeah.
And they might buy into it.
Yeah, but it's a vicious world out there. But just finding somebody that, you like, that sits and talks with you and just helps you understand. You've just got to understand. So yeah, I do a lot of education.
I think for you, in my opinion, the YouTube is going to be huge, because how I started my law firm is I was doing debt collection defense. So people that got sued by their credit card companies or a debt collector, I would defend those people because there wasn't really any other attorneys doing it. Or there were a few, but and I was able to put some YouTube videos out there and just educating people, maybe 10 videos. Yeah. And they were terrible videos. I mean, I was in my living room just with a cell phone and talking about, what you can do, what defenses there are. And some of those terrible videos have thousands of views now. And I'm like,
yeah, because the content, people, that's awesome.
Yeah, but it was just the education, because there wasn't much out there to help people just figure out what's going on with this case.
Well, I'm kind of in the opposite, where there's so much out there.
Okay.
And it's what do you weed through? Especially when, and Medicare's usually the call to action. Nobody wants to, wake up and say, oh, let's make an appointment to talk about retirement. Medicare's usually the call to action. It's okay, what if I'm still working? Do I have credible coverage? If I decide, we do a cost analysis. I don't play he said, she said. We look at numbers. The numbers don't lie. Yeah. So, is it better to stay on your group insurance versus going to Medicare? It depends on your situation, if you're carrying family members and, this, that, or whatever. But yeah, at the end of the day, it's just, you've got to advocate for yourself. You've got to know what's available out there. And there's so many new things. Like I said, you're not going to retire like your parents retired, especially if parents retired in the 80s and 90s. It's not as simplistic. It's not the same.
Those days are gone.
No. Yeah. Those days are gone. And Medicare Advantage plans are just so my husband has original Medicare and TRICARE for Life. So TRICARE for Life acts as a supplement. So he doesn't need to pay for a supplement, but that's how they work together. And there's a lot of people that will they'll say, oh, you qualify for this veteran plan. Okay, well, this veteran plan, they're talking about Medicare Advantage plan. And what happens if he goes on that? It's a Medicare Advantage plan. If he goes on that, he forfeits original Medicare, which really messes up his TRICARE for Life. That's scary.
Yeah.
But people don't know. And there's a lot of people out there that sling insurance and just talk about all the benefits of it. They don't even understand how original Medicare works.
Wow.
Yeah.
That's scary.
It is. It is. But it's all around the dollar.
Yeah.
Everybody's trying to make a buck.
Well, not us.
No,
We're here to help.
You got to make you got to pay your bills and but there's a lot of things. That's one of my biggest questions that I do get is, how do you get paid? Mm-hmm. And I'm actually kind of pretty proud when people ask me that, because I'm like, oh, you see our value.
Yeah.
Because you're kind of like, you're doing all this for me, but I'm not paying you anything.
Yeah.
That's a compliment.
That's awesome.
Yeah.
Well, I think you're doing the right thing. And I like the way you do this holistic thing, because doing it piecemeal, to me, it doesn't make sense if your professionals aren't talking to each other. If they don't know what's going on the retirement side versus the Medicare, Medicaid side. Mm-hmm. I mean, I think that's huge. Yeah. So I think what you're doing is the right thing to do.
Yeah. And even down to Social Security, a lot of times people are just like, oh, well, this is my amount and I should wait till my full retirement age, when it's like, do you know how precious those years are from 65 to 67? Tomorrow's not promised.
Right.
And yes, maximizing your Social Security is super important, but
it's a lot of things to think about.
Yeah, it is. And it's like, let me understand. And that's what we talk through, is these different phases. What does it look like here versus here versus here? Because tomorrow's not promised. And a lot of those years are very precious. And there's a reason why Social Security, shows you those statements at a monthly amount and wants you to work to your full retirement age, which is 67. And they want you to defer and draw. Well, they're just hoping that, the longer you defer, the higher your amount goes, but then shorter your lifespan.
Jeez.
So, fun things.
Thank you, Uncle Sam.
Yeah.
Oh, here's the $1 million question.
Okay.
Is Social Security going to be around for you and I?
Okay. So here is my opinion. Is Social Security on track to be insolvent? Yes. Do I think it'll actually go away? I hope not, because there will be a lot of people in trouble.
Yeah.
Because there are a lot of people that are just dependent on Social Security. There are people that have been living on Social Security since their lives are born and are so dependent on it. I do think people like you and I who are able to earn income need to consider it as icing on the cake.
Yeah.
And not a main source. If you're able to, let's say you have an employer that is offering a 401, start them. Take the free money. There's a lot of young kids that are like, it's like, you need to start. You need to start somewhere. Don't spend. Like, you don't need to keep up with the Joneses. You can still have a quality of life, but you still need to save. Just educate yourself. There's a lot of people that they're doing like day trading for fun. And I'm like, that's just even if you don't keep up with that, that's just a really good, it gets your financial footing started for you to understand and think outside the box. In the next 20 years, it's already changing. Remember I was saying like people used to retire with pensions? Well, pensions are the day of the past. So I can imagine how people are going to be retired in the next 40 years. They're probably going to be getting paid from some other line of something that we haven't even talked about. It's just constantly evolving, just like everything else. Can you keep up with all the things? No, it's really hard. But having a good understanding and a good grasp is definitely important. And thinking about, the what ifs, it's very typical in a household. There's one higher income earner versus the other. And heaven forbid, if that person, isn't here anymore, what's the plan? Yeah. What does life look like? It's like that even in my household. Like if something happens to my husband, I don't even know how to pay the electric bill. He takes care of all that, But those are conversations that we have. And a lot of times you don't have it all figured out, but it sparks, questions for you guys to go home and discuss.
Gotcha. That's awesome.
Yeah.
Well, thank you. Thank you for being on the podcast. Anything else you want to say to the world? You got the message out?
To all the things.
Yeah, I think that was super educational and very awesome. I think everybody should go to your website, check it out, and check out the stuff coming soon from you.
Yes, thank you.
Shantel Haines from Next Phase Consulting. And this is Mind Your Own Business Podcast. Please like, follow, and subscribe. Leave a comment down below if you liked or didn't like something. Tell us what you didn't like. Tell us what you hated about my outfit or my beard, whatever. But thank you for being on. It was great to have you.
Absolutely. Thanks for listening.
I'll see you around the office.
Sounds good.
Thank you.